Have you ever felt pain in your lower back after sitting for a long time, or after lifting something heavy? If yes, you're not alone. Hello everyone, welcome to the channel. Around 8 out of 10 people experience lower back pain at some point in their life. But here's the good news, most lower back pain is not serious. It can improve with simple exercises and small daily changes. We are here to help you improve your health, increase your range of motion, and guide you on the road to recovery. In this video, I will explain simple exercises that can help you reduce pain, move better, and feel more confident in your daily activities. Now let's start with the first exercise, pelvic tilt. This exercise helps to strengthen your abdominal muscles. When your abdominal muscles are strong, they support your lower back and reduce pain. Starting position, lie on your back on a mat. Keep your knees bent and your feet flat on the floor. Action, slowly pull your lower abdominal muscles in, like you are trying to press your lower back into the floor. Push your back gently into the mat. Hold this position for 5 seconds. Keep breathing normally. Do not hold your breath. Then relax. Repeat this 10 times. This exercise activates the deep core muscles that protect your lower back. Next exercise is side bending. This is a strengthening exercise for your oblique muscles. Oblique muscles are the muscles on the sides of your abdomen. They help in bending and supporting your spine. Starting position. Stand up straight. Keep your arms by your sides. Keep your feet shoulder width apart. Action. Slowly bend your upper body to one side. Lower your shoulder slightly, and slide your hand down the outside of your thigh. Do not lean forward or backward, just bend to the side. Hold for a few seconds. Then slowly come back to the starting position. Repeat on the other side. Do 10 repetitions on each side. This helps improve side strength and spinal stability. Now let's move to hip rolling. This exercise also strengthens the oblique muscles and improves trunk control. Starting position, lie on your back on a table or mat. Keep both knees bent and feet flat. Cross your arms over your chest. Action. Slowly turn your head to the right. At the same time, gently lower both knees to the left side. Let your knees relax down, do not force them. Then bring your knees back to the center. Bring your head back to the center. Now repeat in the opposite direction. Do this slowly and in a controlled manner. Repeat 10 times on each side. This exercise improves coordination between your upper body and lower body and helps reduce stiffness. Now let's move to lumbar stretching. This exercise helps to reduce tightness in your lower back and improves flexibility. Starting position. Lie on your back on a firm surface. Keep your knees bent and your feet flat on the floor. Gently pull your abdominal muscles in and flatten your lower back against the floor. Knee to chest with back straight. Again, bring one knee towards your chest. Keep your back straight and controlled. Hold for a few seconds while breathing normally. Then slowly lower the leg down. Repeat on the other side. Move slowly, don't rush. Leg raise with back straight. Now raise one leg upward while keeping your back straight and stable. Hold for a few seconds. Then slowly lower the leg back to the starting position. Repeat on the opposite side. This helps improve control and stability of the lower back. Next is lumbar extension. This exercise is commonly used to correct lateral shift and help centralize symptoms. That means it can help bring pain from the leg back toward the lower back, which is a positive sign of improvement. Starting position, stand straight. Action. Place your hands on your lower back for support. Slowly lean backward. Do not bend your knees. Go only as far as comfortable. Hold for a few seconds. Then return to the starting position. Repeat 8 to 10 times. Move slowly and avoid sudden jerky movements. Now let's move to deeper lumbar stretching. This stretch targets the muscles along the spine, especially the erector spinae muscles. Starting position. Lie on your back in hook lying position, that means knees bent and feet flat. Action. First bring one knee toward your chest. Then bring the other knee up. Clasp your hands around your thighs and gently pull both knees toward your chest. As you pull, your lower back and sacrum will slightly lift off the mat. Hold for a few seconds while breathing normally. Then slowly release and return to the starting position. This stretch helps increase lumbar flexion and reduce tightness. Quadruped lumbar stretch. Child's pose-like movement for lumbar flexion. This exercise is done in quadruped position, that means on your hands and knees. Starting position. Come onto your hands and knees. Keep your back neutral. Action. Slowly move your hips back toward your feet. You will feel a gentle stretch in your lower back. Hold for a few seconds. Then slowly return to the hands and knees position. Repeat 8 to 10 times. This exercise improves flexibility and reduces stiffness in the lower back. Now let's talk about pectoralis stretch posture correction. This exercise helps stretch the pectoralis muscles, the chest muscles, and improves posture. Starting position. Stand facing the corner of a room. Keep your legs together and your body straight. Now extend both arms and place your palms on the opposite walls of the corner at shoulder height. Action. Slowly lean your body toward the corner. Keep your body straight. Do not bend your knees. Keep your heels firmly on the floor. You should feel a gentle stretch across your chest and the front of your shoulders. Hold this position for a few seconds while breathing normally. Then slowly return to the starting position. Repeat this movement several times. As you improve, you can gradually stand a little farther from the corner to increase the stretch. This stretch helps open up the chest, improve shoulder alignment, and support better overall posture, which reduces stress on the lower back. Remember, consistency is more important than intensity. Do these exercises regularly, move mindfully, and take care of your posture. If you found this video helpful, please like and share it with someone who might need it. And if you have any questions, or have been dealing with back pain, let me know in the comments below. Thank you for watching, stay active, stay healthy, and see you in the next video.